Researchers are racing to develop a vaccine that could help halt the Ebola virus. One thing slowing the process is money. Pharmaceutical giant Johnson & Johnson, though, planning to spend tens of millions on this cause. Our News 9's Heather Hope has reaction from a local hospital. Heather?
Amanda, there are a handful of Ebola vaccine trials going on in the U.S., but one major issue here, pharmaceutical companies don't see a big enough market to develop an Ebola vaccine. But that's not stopping many doctors from trying to get ahead of the curve.
Vaccines, what they do is they ramp up your antibody production. So if you make antibodies against something, it'll recognize it, and if you're exposed to Ebola, you'll already have antibodies against it.
The idea of vaccines is simple, but creating a vaccine powerful enough to take on the widespread Ebola virus has become a huge undertaking.
I think that there's a lot of angst about Ebola right now, and I think that any efforts to try and arrest the current situation in Africa are very, very important.
David Chansom oversees infection prevention and control for Integris hospitals. He says, like the flu vaccine, the Ebola vaccine will mimic the virus to help the immune system fight it. For now, Chansom says Ebola survivor Dr. Kent Brantley is a walking Ebola vaccine after donating his blood to 2 Dallas nurses and that freelance photographer who were all infected. So the race for an Ebola vaccine is on. Johnson & Johnson plans to invest up to $200 million to develop a vaccine. The National Institutes of Health and a British drug maker are creating a vaccine from a modified chimpanzee cold virus and an Ebola protein. Another vaccine is being developed at the Walter Reed Army Institute of Research in Maryland. Chansom says it could take months before all the data is in, but it's worth a start.
Vaccination is a huge part of that effort. It won't fix the problem by itself, but it'll definitely help.
Johnson & Johnson plans to begin testing an Ebola vaccine in January and hope to have 250,000 doses available by May. Heather Hope, News 9.
That is promising, Heather. Thank you. Not Ebola, but the flu has officially hit Oklahoma. 2 children under the age of 5 are the first 2 confirmed cases in the state this year. State health officials remind everyone, go ahead, get that flu shot. They also recommend frequent hand washing this time of year and staying home from work or school if you feel ill.